Okay.
Good morning. I would like to thank each of you for joining at our first virtual town hall meeting. We have pre-recorded this meeting to air at our normal meeting time. For those of you who wish to watch this again, or who may have a neighbor or a friend who are unable to view it at this time, it will be made available on the neighborhood website shortly after the conclusion of our comments here today. Due to the unique nature of this meeting, residents were asked to submit questions ahead of time, either by email or by filling out the form over at the clubhouse front desk. We received a total of 23 questions by these methods and topics ranging from COVID-19 to dining to IT services. I intend to address most of my comments here today. First, I would like to ask Dan Lavender to give us an update. Dan?
Thank you, Ross. I'll give you a brief business update, similar to what I've done the last couple of times. Then we'll start our COVID-19 topics. I'll talk about testing, what we've done, and what our plans are going forward. Then turn it back over to Ross, who will go through some more COVID-19 and dining service matters, some other miscellaneous matters, and we'll end with a small presentation on the Memorial Plaza that is planned for across the clubhouse. I'm going to do just a real quick business update because I think the COVID-19 is so much more important. It really hasn't changed from the information we've communicated in the past. We now have May's financial results. May, we had from $62,000 operations from income positive, virtually break even. So again, that is sustainable for a long time. May, just the month, was $382,000 over or off of budget, and we're $700,000 worse than budget year to date. So it's not immaterial, but again, because of our A rating or an A+ rating by Fitch and Standard & Poor's, and because of our financial strength, we can sustain break-even operating performance for a long time. Still two major factors creating the negative variance: IL occupancy, and we have actually had a sale or two over the last couple of weeks, and we're getting a lot of interest in Moorings Park, and Chateau occupancy. Chateau occupancy actually ended May at the high point for the last 2 months, so we're still well off of where we would normally be, but in both of those areas, IL occupancy and Chateau occupancy, we're seeing positive movement. The other third factor from our financial performance, as you know, has been the investment portfolio. More good news from the May financials, where we added a little over $5 million in earnings, either interest or gains realized or unrealized to our portfolio. That puts us for 2020 down 1.85%. And if you look at an annual return from June 1st of last year to May 31st of this year, the portfolio is up 5.58%. So again, to conclude, we are having some difficulties with the operations, but it's very sustainable, certainly for some time, not sustainable long-term over a 3 to 5 year period, but in good shape moving forward if we continue this performance. With that, I'm going to move on to the COVID-19 topic, which is, I think, the most interesting right now. Certainly from a big picture level, we are certainly seeing quite a rise in cases here in Collier County. We got several questions about testing, so I'm going to give you a brief summary of the testing that has already occurred, talk a little bit about the challenges with testing, and then talk to you about what you can expect to see moving forward with testing. Actually, I'll start with the challenges. We have two major challenges with testing. One is we're dependent on supply chain issues. It is still very difficult for us to get bulk tests outside of the government programs. And then we have to deal with logistical issues. To conduct these tests, we did 350 tests a couple of weeks ago. It took 5 FTEs 3 days to conduct those tests. So we're working to improve the supply chains and the logistical issues so that we can do even more testing. What have we done so far? About 2 weeks ago, we did every employee and every resident in the skilled nursing facility in the Chateau, part of the governor's program. Next week, or by July 7th, we will get more supplies to retest all of the employees in the Chateau. At Orchid Terrace, which is our assisted living facility, it's the exact same story. We tested all employees and all residents once already, and we have to do it again by July 7th, and we're waiting for the supplies to come to us from the government. And this time, however, it is only employees that we need to test, not employees and residents. We have tested every home health employee that works on either one of our campuses, including the one here on Goodlet. We have tested all new employees and residents in the care areas, which would be assisted living and in the skilled nursing area. And then again, in compliance with CDC recommendations and the public health recommendations, we need to have a supply of tests on hand, and we have about 60 or so today that needs to be held so that we can do on-demand testing. So far, we've conducted over 250 on-demand tests. On-demand tests would be if you show symptoms, if you have a temperature when you're getting screened, if you answer any of the screening questions that put you in a higher risk category, you're getting an on-demand test. We've had a few tracing processes, as you know. If you're identified in that tracing process, either by us or by the public health department, you're getting tested on demand. Moving forward, we are vigorously exploring supply chain issues. We're looking at alternatives. We expect a proposal from NCH today that will allow us to partner with them and apply the same antibody testing that they're doing to their employees to all of our employees. We are avidly pursuing various machines and testing equipment that we could have in-house. And so we're doing all the testing required, all the testing provided by the government, and are looking for ways to continue to expand the testing. I want to end with this, though. If you go to the CDC website, you look at the overview for testing for SARS, you look at the business and employee guidance, you look at the control and prevention document done by the CD, which we study and look for updates all the time. Testing is not the primary recommendation, other than the on-demand testing. We're still going to do a lot more than that, but the primary recommendations still continue to be do daily health checks, which we're doing, conduct continual hazard assessments, which we're doing, and I know we sound like a broken record, but we're going to say it probably a couple of times again, conduct safe practices. Wear the masks, keep the physical distance or the social distance, wash your hands frequently. That's an update on where we are with testing. We've conducted roughly 600 tests so far, probably kicking them out at a couple of hundred every week, and are continuing to explore new ways to expand the testing. With that, I'll turn it over to Ross to go through some other COVID-19 issues.
Thank you, Dan. I know that normally a town hall meeting is going to be addressing a myriad of issues in the community that most residents would have an interest in. After we took a look at the 23 questions submitted, it became very evident, and to no surprise of anyone, that the area of interest was predominantly the COVID-19. So we have essentially focused this meeting on COVID-19, trying to provide you with as much information as possible. I don't believe any one single meeting of this nature is going to fulfill that expectation, but hopefully what comes out of this is enough information for you to feel comfortable with, or at least create and generate some additional questions that you can either bring to the executive director, the associate executive director, or myself. Let me briefly tell you the topics I would like to address with you. First of all, we had a very unfortunate loss at the original campus with one of our independent living residents, so I'm going to briefly discuss that. I would like to speak with you about security and front gate measures. I'm going to talk briefly about metrics, essentially data, and how we're making some of our decisions and how data is playing a key role in that. Then I want to talk to you about something that Dan essentially just hit on, but I'm going to go into a slightly deeper detail, and that's on protective equipment and also overall general safety. This whole virus has created a mental fatigue for virtually everyone. But there is something that is positive right now, and that is we're doing a pretty darn good job of managing under the conditions that we're dealing with. There is no question that the state of Florida has erupted into a high number of cases. In the last few days, we have gone anywhere from 5,500 cases per day, 5,200, 5,000. These are incredibly high numbers. And then, of course, in Collier County, we've also witnessed a spike, and a pretty substantial one, where there are some new hotspots as defined by the Florida Department of Health down here in the southwest corner. Even with all that, I think we have to look at this whole situation as one where we are implementing as many measures as possible, and we are also making some strong recommendations to both our residents and mandating it for our staff. And so as I come to a conclusion on this particular briefing, I will be making a request of all of our residents. On to the first topic. If you read update number 40 or Dan's update number 3, we had the unfortunate experience of having to report out that we had lost a independent living resident at the original campus due to complications related to the COVID-19 virus. This was a sobering experience for all of us. We read about it. We heard about it. We knew that other communities had experienced this, but this was new for us. I wanted to share with you some details about this, not specifically about the person or people who may have been around this person, but the process that we go through when we do have somebody who's identified as COVID positive. First of all, the number one thing when we get notification, whether it's from a physician, whether it's from the health department, the hospital, or even if it's a self-report where a resident informs us that they have just received tests back from a local test perhaps that their doctor scripted for them, the first thing we do is we ensure isolation, or commonly called self-isolation. In most cases, the doctor would have already indicated that, but it's imperative that everybody who needs to know is aware of that. So who needs to know? Well, certainly our housekeepers, because we don't want to spread the virus. Any partner who goes into that particular environment to serve their needs has to be aware. We have to wear the proper protective equipment. We have to exercise certain precautionary measures. But what we can't do, and we're bound by law on this, is we can't violate the HIPAA law. We cannot violate the standards of confidentiality when it comes to an individual resident. We are asked a lot of questions on a daily basis. Who was that? Was I near them? Who infected them? Who's responsible? Can you provide me more details? And the simple answer is no, I cannot. What I can tell you with a high degree of confidence is that the tracing process, the contact tracing process conducted by the health department is very thorough. And if I didn't believe it before, I certainly learned that this week as I was privy to a 1 hour and 15-minute meeting from the director and the 3 investigators on this particular case. They walked through the entire process for me, and they helped solve answers to questions that even I had. For instance, a number of residents under this particular scenario had asked, why didn't they call me? Why haven't I had a knock on the door? Why am I not being tested? Well, they do look at that. Their tracing is incredibly detailed, not only from the information we provide here at Moorings Park, but also from friends, family, travel that they engaged in, local travel, all the way down to grocery stores they went to, gasoline stations, and so forth. And so they are aware who to contact and who to take the next step with when it comes to testing, or even to ask a battery of questions. So it's really a follow the trail process, and it's quite fascinating how they do that. Essentially, if they're in contact with you, then they do believe that there is a possibility, maybe not even a probability, but a possibility that there could have been contact. They will look for when that resident or that staff member was first determined to be tested, and then when they were actually confirmed to be positive. Those are vital dates to them. And then they will also find out if they ever left the campus. So in the case of a resident, if they left the campus to go visit a doctor, go shopping, go out with a friend, go to the dining off the campus, anything like that, those are all vital pieces of information. They also want to know if the resident is still engaged in the incubation period of this virus, which can be different from 1 or 2 days all the way up to perhaps 4 or 5 days. And that's essentially the period of time that that virus is developing inside the body. And so in the earliest stages of that incubation period, the resident may not actually, even though they're a carrier of that particular virus, they may not test positive. Housekeeping sanitizes and does a very thorough process. We just purchased an electrostatic machine, which is the best on the market right now for sanitizing spaces. We verify that that quarantine status is working and that nobody leaves. And then we also receive a final report from the health department, which is something that I look for very carefully. And then we do a debrief with our own team. So I essentially walk through the process that we go through. There is a lot of granular components related to that process, but that's the high-level picture. It's extremely thorough. It involves a number of investigators by the health department. Certainly that's matched up to the magnitude of the problem, but this is essentially how this works each and every time. Let me move on, if I may, for a moment and talk about security and front gate operations. I receive a lot of emails throughout the week, and so does the security manager, Jeff Lane, as does Celeste Lynch, about security operations. There has been a couple of instances where we've had some new gate officers that did not ask the full battery of questions. I believe that I have addressed that now with our facility management department. We have gotten these young men and women up to speed as quickly as possible. And I believe now that they are asking every single question that's necessary. So what are these questions? These are the questions that the Center for Disease Control and Florida Department of Health are expecting us and actually mandating us that we ask. So these are questions such as, do you have any signs or symptoms of the COVID virus? And then identify some of those signs or symptoms. Have you been around anyone who has had the COVID virus or currently has it? Another question we ask is about travel. And the travel directly focuses on hotspots throughout the United States. The most recent information we have is there are 4 states identified by the federal government. Those are New York, New Jersey, Connecticut, and Louisiana that have an inordinate number of cases. I suspect that that'll change. As a matter of fact, Florida could easily be added to that in the very near future if it isn't already been added today. The reason why this is important is because anybody who visits those states, defined as hot states, they will have to self-quarantine when they come back. This is not a Moorings Park standard. This is a federal and state standard. And it's regardless of the mode of transportation that you utilize to go to that state. So you could drive there, you could fly there, it doesn't matter. But upon return, you have to self-isolate, at least for the time being. Now, this could change. We monitor this very carefully, both with the state and the Center for Disease Control. So we ask that question. We also take temperatures coming in. And the temperature reading of the normal body temperature is 98.6. But not everybody is at 98.6. We have some people in the high 97s. Sometimes people have their air conditioning on high, and they're actually much cooler than that. But if we get a reading of 99 degrees or greater, we actually ask the vehicle to pull over to the side, and we request that they step out, and we take 2 additional readings. If those 2 additional readings continue to read 99 or higher, a manager is brought out. In this particular case, on this campus, this is going to be Celeste Lynch or myself, and we will continue to ask a series of questions of the person, but we will not allow them access onto the campus until they've first seen a doctor and they have a test, and that test rules them out for being positive. Now, the general rules put out by the Center for Disease Control has always been 100.4. We've added an additional buffer on that. We just don't want to take any additional chances. Visitors and contractors. Yes, we have opened up to non-essential contractors onto the campus, but regardless of whether it is a partner, a resident, whether it's a contractor or a visitor, everyone must go through the same screening process at the community. And if there's a passenger, we should be walking around and taking the temperature and asking the same exact questions of the passenger. No shortcuts in this process, and we're monitoring this as closely as possible. If there is a slip, we'll reconcile it as quickly as possible. Let me talk momentarily about metrics. Metrics, or the data we receive, is instrumental in making decisions. It is not the only thing that allows us to make our decision or empowers us to make certain decisions. But we're constantly reviewing available data, both at the state and the local level, to help guide our daily actions. A couple of questions that were presented to us for this meeting regarding additional loosening of restrictions revolved around dining. And those questions simply were about how close people could be. Why can they not have 4 to a table? Another question was the type of dinnerware we're using, and china glass and silverware. And then most importantly, the total number of people that we are allowing into the dining room as far as a percentile of total capacity. Let me see if I can answer a few of those questions. First of all, on the issue, I'll take the easy one first, china glass and silverware. We started off with bamboo, disposable. We did our level best to try to make that aesthetically pleasing. But we learned real quick that with our dishwasher, with a rinse cycle of 180 degrees, any and everything was going to be killed, including the soap system that we use. So we were able to go to a formal china glass and silverware process, and we're comfortable knowing that is sterile. We're currently operating at 50% total capacity. The state of Florida allows us to do that, but it took us a while to get to that level. We didn't jump into that as quickly as possible and as soon as we were authorized to do it. It took us a while to blueprint the dining rooms and really gain a full 6-foot distance. And we still, to this day, do not allow 4 people at a table. Now, I recognize that makes it difficult for pleasant social interaction with friends. It actually prohibits couples from going out to dinner with each other unless they want to have a discussion 6 to 8 to 10 feet away, which is not very nice. But it is the right thing to do right now, and we're not yet at the juncture where we're ready to move forward and open that up. We sat at the 25 percentile of overall capacity for quite a while. And then we felt that we were able to effectively move up to the 50. I think we're doing that well right now, both at Mornings Park at Gray Oaks and also at the original campus. But I do not believe that we're at that point we're ready to move forward yet to expand that. And the state is not ready to move forward yet to expand that. We essentially are going to continue to provide home health services, meaning home delivery rather, not home health, home delivery services for food until we believe that it is no longer necessary to provide that service. And that could take some time. That's a judgment call. I believe we're quite a ways from that at this point, but we'll keep you posted. Certainly we couldn't do it now. We wouldn't want to do it now. And the reason behind that is because there isn't enough utilization of the dining rooms to be able to reduce the number of covers or meals that we're presenting at home to people. In other words, we're running 2 businesses out of the kitchen right now. So the whole idea is as the number or the capacity of the dining room goes up, the number of home dining goes down. That has not gone down to the level where we could reasonably go to full dining in our dining rooms, not including the fact that from a safety standpoint, we're not ready to do that either. So for the short haul, we're going to continue to provide home dining, just as we have been ever since that we have had this pandemic fall upon us, and we'll continue to forge ahead under that particular protocol while we also simultaneously run the 50 percentile of the dining rooms. Under the metrics, I also wanted to share with you some recent numbers in the state of Florida as of today. We've been holding almost 5,500 new cases each day. As a matter of fact, today was the first day that we dropped down to about 5,100. Total number of people hospitalized in Florida is now 14,000, and it's on a steady rise. And that is not good news because it wasn't that long ago that we saw a steady decline. Total number of deaths in Florida is now at 3,400. You may remember that not long ago, the estimate from the healthcare matrix was 1,600, so we've exceeded that by a substantial margin, but so too has all the neighboring states and most of the states throughout the United States. Collier County, 3,500 cases. We're seeing a substantial rise, particularly in the east side of the county, and we're working hard to try to mitigate anything that could be causing problems for us. Now, it is true we have a number of our partners that reside in the eastern part of the county. They are well aware of the importance of following all the precautionary measures, and I have a lot of confidence that they will do that. I'd like to move on now to talking a bit about PPE, or better known as personal protective equipment, and general safety. The most important thing that everyone can do, and I know that this has been heard time and time again to the point where probably most everyone is tired of hearing it, but Dan is 100% correct in what he said. This comes directly from the health department and from the director. It isn't more testing, although testing is critical. It is following the fundamentals. And that's what's so frustrating about this particular virus is that it requires adherence from everyone. And that adherence to precautionary measures will make the difference. We've already seen it when we were in a stay-at-home mode with the state. And then when that was lifted, we saw a general relaxation throughout the state. And so now we can continue to see a rise. And we have to be vigilant and we have to be committed to this. And this is everyone. In the case of employees or our partners, we have set a very clear message to them that their adherence to following these protocols is a condition of employment, no exceptions. If you want to work at Moorings Park, we value you. We think the world of you. You're critical to our success, but we cannot allow you to avoid following these protocols. And yes, occasionally we have found somebody slip their mask down, and we correct that as quickly as possible. We've also put signage in as many locations as possible. We learned today there's a few areas that we've missed, and so we're going to go back and place signage there as well. These are constant reminders. We're putting signage in common areas, outside of dining spaces, near the fitness centers, in the lobbies, and we'll add some more of those based on our meeting today. But it's important that the signage is just not sitting there and not being paid attention to by all of our residents and staff, but it's being adhered to. I say this with the utmost level of respect and sincerity. But wearing of the mask is critical to stopping or at least slowing down people getting infected. So as I said to the staff, and I'll say in this particular meeting, if you yourself do not want to wear the mask, I ask you, I implore you to please wear it in the interest of your neighbor and your fellow resident. It's that important. Management occasionally has found that both of the partners and our residents feel differently about how this should be managed for protection. But again, regardless of how we feel personally, I think it's imperative that we come together and we wear that. So if you are inside of a building, other than your own home, any common spaces or around any people, unless you're just walking on the walking trail, the expectation, the request is that you have a mask on. And then when you leave and you're back out in the open air and you're not around anyone, that's fine. The probability of any infection there is somewhere between 0 and nothing. But while you're around other people, if there is an infection, it's going to get passed. I don't mean to be overly firm on this, but I thank you for allowing me to reiterate that message one more time and share with you the criticality of it. That is my update on COVID. I hope I was able to answer some questions. I tried to take everything that was presented to us over these 23 questions and really zero in on what I felt was most important to our residents. With that, I'll hand it back to Dan.
Thanks, Ross. That was extremely well said. And, we have one more topic. We're going to have to do a little turnover. We're going to cover the Memorial Plaza. That's going to be about across from the clubhouse. But I just want to one more time before we do the changeover and put the PowerPoint up. This is serious. We lost a life last week. Our hearts, our prayers, our thoughts go out to that family and to each of us here at Moorings Park. Cases are at their highest level in our area. Hospitalization is at the highest level in our area. We don't know when this is going to end, but we're going to keep doing our level best to protect this organization, to protect the employees that work here, and to protect the residents that live here. But as Ross so eloquently put, we need you to do your part. Take these precautions serious. We're going to take just a minute break, load up a PowerPoint, move the tables around, and then we'll close with a little bit on the Memorial Plaza.